Ladies and gentlemen, please welcome to the stage the First Lady of Georgia, Marty Kemp, and Kevin Tanner, Commissioner, Georgia Department of Behavioral Health and Developmental Disabilities, Ryan Greenstein, Associate Director, Public Policy, Mental Health Program, the Carter Center.
Well, good afternoon, everybody. How are we doing today? Is the room empty? How are we doing today? First of all, I want to thank Health Connect South for inviting us today and making sure this panel is right where it belongs. I think everyone on this stage agrees you can't have a health conference and not talk about mental health. So really want to voice our appreciation to Health Connect South. Special thanks to Russ on behalf of the Carter Center. He's been a tenured member of our Board of Counselors, and we're so grateful for that support. And I also wanted to thank everybody who came out last night to help the Carter Center celebrate President Carter's 100th birthday at the Fox Theater. He'll be turning 100 on October 1st, which is a first for any United States president, and we're very happy about that. Now, President Carter actually spoke here at Health Connect South about 10 years ago, and he told the attendees then that quote, working collectively, we can open the door to untapped opportunities to advance health and accelerate progress. I think that remains true today. So on that note, I'd like to thank you all as well for being here for today's conversation. Now, President Carter is also a former governor of Georgia, and he also, when he welcomed all the Health Connect South attendees then, acknowledged that our state is blessed with many wonderful resources, with the greatest being our people, and I'm honored to be able to share the stage and introduce two of those wonderful resources here today. First Lady Marty Kemp has led several initiatives since her husband became governor 6 years ago. She leads the Grace Commission as part of her efforts to combat human trafficking in our state. And as you just saw, she's also been the face of the state's 988 suicide and crisis lifeline alongside with DBHDD. Commissioner Tanner, joining the stage as well, leads the Georgia Department of Behavioral Health and Developmental Disabilities. He's also been a county manager of Forsyth County. DBHDD also operates state hospitals and provides for community-based services across the state through contracted providers. The state serves people living with mental health challenges, substance use disorders, intellectual and developmental disabilities, or any combination of these. Now, I want to start off, I know everyone just saw the PSA. Commissioner Tanner, I know there's a diverse group in the room. Some may be very familiar with 988. For some, that PSA may have been the first time they've heard about it. Can you level the knowledge field and just tell us what is the 988 Suicide and Crisis Lifeline, and what is your agency's role in it?
Yeah, thank you, and thank you for being here. How great is this for mental health, looking at that scene right over there?
It's the best.
It's incredible. So I always do this when I talk about 988. Just raise your hand if you've heard and actually know what 988 is. Good. So we're making progress. So for those of you who either didn't raise your hand or those who raised your hand and wasn't telling the complete truth, let me tell you what 988 is. So 988 is a national 3-digit number that came online in July of 2022, so just over 2 years ago, and that is a national crisis and suicide hotline. Georgia stood that up a couple of years ago. We already had a 1-800 number, but we transitioned over to 988, and it is the easy button to access care in our state. You can call 24 hours a day, 7 days a week, text or chat to access a trained clinician, completely anonymous, anytime from anywhere. We can also dispatch mobile crisis teams to you anywhere in the state, 24 hours a day. That includes a trained clinician. We also can access our crisis system network of a safe place to go. So it is a continuum of care, and we're receiving roughly 20,000 calls a month currently, and we're answering those calls on average in about 10 seconds from the time they call. As healthcare providers, I encourage you to help me train and inform your patients about this valuable system in our state.
And I'm going to add to that, not just your patients. I was thinking about earlier today, I know the medical community disproportionately more likely to be at risk of suicide. So really taking this back to your communities is something we all need assistance with. The First Lady Kemp, thank you for being here.
Thank you. Honored to be here.
Yes, I know there's a lot of initiatives in the state that you've become involved in. Like I said, human trafficking, and there's many other issues that it could have thrown your force behind. So I'm curious, can you tell us a little more why 988 has been such a priority for you recently?
Well, thank you for having me. I'm honored to be here. My first initiatives before Brian was, after he was elected but not sworn in yet, I thought I had a great idea to have, to do school safety, animal cruelty, and mental health, because I felt like they were all entwined together. And I had a great idea to have a canine, because I'm a very big fan of canines, if any of y'all knew that, at each school in the state, which actually they are, they're working on that right now, which I think is a fantastic idea. But human trafficking fell into my lap, and so there was really, when the Lord lays those things on you, the hard topics, you need to talk about them. And so I felt like that I really needed to put my arms around that, since I had a megaphone and I could do that, because it wasn't something that it was not a topic anybody was talking about. And I understood when I learned more about it why people weren't talking about it, but that we needed to talk about it. So that's when we started working on that, and then Commissioner Tanner asked me to do the 988 campaign, which I was honored to do. And, I don't have a problem. We have 3 daughters. I have watched our girls and their friends struggle with, the pressures that they have in their lives, the pressures they put on themselves, the pressures other people put on them. And it's just something that we need to talk about. It's just something that I think that's one of the biggest things to tackle, and then have the resources there. And Brian is definitely a huge supporter of that. And so we're working on things, but we've got a lot more to do, and those are in the works. So
That's wonderful. And for those of you who have not seen, we've done this panel a few times. The PSA has been blasted out everywhere. Commissioner Tanner threw out the first pitch at 988 night at the Braves game back in May. So my question for you all, for both of you, now that the awareness campaign has been running for a while, what comes next after that? Like, if everybody who truly is in crisis starts calling 988, can the state handle that? Are there additional federal or state legislature resources you would need to manage that caseload?
he got the ball over the plate. It sailed over, so we were very proud of him.
Well, I told the First Lady earlier it was actually a foul, but it did get over and it didn't hit the dirt. So I think that's a great question. And one of the things as an agency we're keeping a very close eye on, and we look at this on a weekly basis, is how many calls are coming in, how quickly are we answering the calls, and what is the abandonment rate. And what that means is if we're not able to answer the call, all of our call takers are busy, it will roll over and get answered at the national level by the national providers. So someone will answer the phone call, but we want to be able to handle those in state. So our abandonment rate is low. Our time from the call begins to the answering time is still in good condition, around 10 seconds. So we're handling it well, but we're going to continue to monitor that. Where we struggle a little bit is on the mobile crisis side. SAMHSA, our federal partner's recommendation is we should be able to, from the time of dispatch to the time the clinician arrives in a metro area, should be 1 hour, and in rural Georgia, an hour and a half. We do pretty good actually in rural Georgia, but it's the metro areas sometimes we struggle. That has to do really with call volume, but it also has to do with traffic, which is challenging. One of the things too, I don't know if I mentioned this, the other thing that's great for young people, because about 10% of our calls come from people under 18, is you can text or chat the 988 system also. Like the First Lady, I have 3 daughters. They don't like to talk on telephones. They like to talk and chat, so they can do that with 988.
And I think, just like I said again, just we talk about it. I mean, get the word out. I enjoy traveling around the state. We have a very big state, a beautiful state with a lot of 11 million great people in it. And it's just really going around and being available and accessible to people that want to talk about it. And I personally feel like when I go around the state with Brian, that a lot of times some people feel more comfortable coming up and talking to me or talking to a female. Not that he's not nice, because he really is, regardless of what you've heard. But, But, it's sometimes they feel more comfortable maybe talking to a female. And I want to make sure that we're accessible. Our girls travel with us a lot. We take a lot of pride in going around the state and just being there to listen and see how we can help and the great things that we can do.
I want to touch on, when you're talking about accessibility, something I heard a few weeks ago from a similar panel. They went out of their way to emphasize that it's the 988 crisis and suicide lifeline. You don't need to wait until being on the cusp of an act of suicide. This line's available pre-crisis, leading up to it, available for anyone, and incredibly accessible.
Exactly.
So you both already touched on this a little bit. We know we're at a national crisis level for suicide. Suicide rates are the highest they've been since World War II. It's really an all hands on deck. That's part of our collaboration with DBHDD at the Carter Center and the First Lady's office. So for everybody else here in the room, I know we have students here, business leaders, a lot of medical practitioners. What is the message you take for, or you give for all of them that they can take home and help support the efforts?
I just left the office a few minutes ago, and I ran into a lady who's now a peer, and we have one of the most robust peer systems in the country. Georgia was the first state in the nation, actually, to get Medicaid to approve to pay for the peer programs 25 years ago this past July. But the lady I saw coming into the office, she tells a story, and you may have saw a video of it. If you haven't, it's on our website. She was pregnant with her child, and she had attempted to take her life and was contemplating suicide again. Her OB/GYN doctor really just did not know what to do. That was outside her training, outside her expertise, but she knew that her patient needed help. Now, it would have been easy for her maybe to do a 1013, have her committed. Might have been easy for her just to forget about it. But she didn't do that. She picked up the phone and called 988. And as a result of that, a clinician responded, activated a treatment plan for her. She's alive today, being treated for mental illness, in full recovery, and works full time now, helping other people lead to a life of recovery. So you're on the front lines of meeting people where they are, hearing their struggles, and no, we don't trust anyone more than we trust our local doctors. You have a great opportunity to make sure that you're not only looking after someone's physical health, but you recognize the importance of their mental health, and you know that you have limitations maybe, but there's a resource available. And let me just say, we have a lot of partnerships with doctors around the state. We have a pediatric training program that we operate that links doctors up with psychiatrists. If you're interested in learning more, interested in getting information in your practice about 988, let us know. We're here to be a resource for you, and we want to be your partner and be collaborative in this effort.
Well, I think, the other thing definitely to take away is to let people know it's okay to not be okay. I mean, I think talking about it, talking to our peers, checking on your friends, checking on your coworkers, ask those hard questions. I challenge all of y'all, and I know that y'all do that, and we are very appreciative of everything you do every day, 24/7. And I know that it's tough, but, there are things that we, like the video says, it's okay to not be okay, and we need to just reassure that to people and continue to check on them.
I think that's worth some applause. Pivoting for a moment to some other activities going on in the state that could have immense impact on mental health in Georgia. We were talking earlier at DBHDD, and our Department of Community Health recently announced that they have approval from the Centers for Medicaid and Medicare for some new waiver options that will essentially allow DBHDD and DCH to provide, we'll institute some provider rates that will basically allow the state to not have to institutionalize as many individuals, help people get care where they live in their homes. Commissioner Tanner, can you talk a little bit about how that's going to impact eligible Georgians and what your message has been on growing awareness for those waivers to the medical community?
Yeah, so when I first came into this role, this December will be 2 years, one of the first things I recognized early on is we had a workforce crisis, not only at our own agency, but in the provider network. And so you start asking, of course, everyone's struggling finding help, but why are we in this desperate situation? And a lot of it went back to the fact that we had not had a provider rate increase across the entire board, in some cases in 20 years. And Georgia had some of the lowest Medicaid reimbursement rates for both IDD and behavioral health in the country. So people were leaving Georgia to provide services in other states. And I'm not just saying this because I'm sitting next to the First Lady, but let me just point out something. The Behavioral Health Reform and Innovation Commission was signed into law in 2019 by Governor Kemp. Since 2019, Governor Kemp has led the charge with the General Assembly to invest an additional $500 million into behavioral health and developmental disabilities in a 5-year period. There's never been that type of an investment in the system in the history of our state. So part of that was we had a commitment that we're going to improve provider rates. We did the study on the IDD side, bringing in a third party recognized by CMS. DCH did it on the behavioral health side. Both of those were funded by the governor and the General Assembly during this session at a cost of over $150 million annually in state dollars. This is a game changer for the system. CMS approved the IDD rate study in record time. The behavioral health rate study's there now. We expect to get that back in the next 30 to 60 days. Get those implemented retroactive to July 1st. We're going to go from the lowest to being one of the best Medicaid reimbursement states in the country. This is going to be a game changer for the system. It will allow, yes. It will allow us the opportunity to build up the provider network. We need to be successful. The other thing that we did and that CMS approved was some new types of placements for very hard-to-place individuals with IDD. If you work in an emergency room, you know that's one of the struggles in an emergency room when a family brings someone and they stay there. They're stuck in the emergency room. Part of that's because they have intense behavioral challenges, and we just have not had a place to take care of those individuals. With the governor's help and the General Assembly's help, we're building the state's first developmental disabilities crisis stabilization center in the state, one of the first in the country that'll open in March in Macon. In addition to that, Mercer Medical is going to run a very robust outpatient center there. And in addition to that, CMS approved 3 different types of placements for hard-to-place individuals. My prediction is 3 years from now, our emergency rooms will no longer have a situation where anyone with an IDD is stuck there. Once we find out about it, they'll just be on autopilot, us getting them to the right location. So it's a tremendous amount of progress has been made thanks to the governor and the General Assembly and for their funding. So thank you.
Well, the commissioner won't say this, but he has been doing a fantastic job in the 2 years that he took this job on. He didn't need a job, but he wanted to make a difference, and he is making an incredible difference. I mean, he is going out and visiting all around the state. He is tapping into the resources that the governor and the legislators are listening, and I would encourage you to talk to your legislators, talk to the individuals in your districts, and make sure that they're aware, which I'm sure that they are, but it's always good to always give them a reminder. So talk to them. But I commend the commissioner. He is doing fantastic work.
One of the goals of Health Connect South, which we've been doing all day, is highlighting great collaborations in the state. I think one that's really stood out to me through DBHDD has been the community outreach and engagement around the opioid settlement funds, of which you are the trustee, Commissioner. So I want to give you a chance to talk to us about where DBHDD is right now in that process in terms of the Georgia Abatement Trust and what we should expect coming down the pipeline soon.
Yeah, so the opioid trust in Georgia, the 2 main settlements, the state's going to get $638 million over the next 18 years. That's from the distributors and the manufacturers. There's other litigation going on that'll bring more dollars to the state. Those dollars I just mentioned are going to flow into the state in a couple of ways. First, there's some participating governments who will get direct funding, and those dollars will go directly to them. $479 million of the funds will come into the trust, which I have the pleasure and honor of serving as trustee for. It's a very robust setup, and it is 60% of that $479 million will be spent on statewide initiatives. 40% will be spent on regional initiatives. The regions all have a regional advisory group that has been appointed by all the local governing authorities for cities and counties for that region. When I first came in, my first question was, how in the world am I going to get an entire region that may be made up of 20 or 30 counties to agree on 7 people to serve? So I reached out to our friends at ACCG and GMA, and they really helped us make that happen. So those are all in place. We opened up the first grant opportunities a couple months ago. We received 308 grant applications, and when we opened it up, we traveled the state and made a purposeful decision that we're going to go to every corner of the state, make sure we're educating people about this opportunity, and we did that. We received 308 grants. 300 of those were deemed complete into our electronic system. The RACs, the regional advisory groups, have completed their work. On the statewide work, the interagency group of experts has completed their scoring. Now we have a GOSAC committee, which is statewide, half the members appointed by the governor, half by local communities. They're going to be meeting in early November. We anticipate awarding $50 million in funding in November and start that contracting period after that. So this is really going to be a once-in-a-lifetime opportunity to be smart about how we spend these dollars to change the course of the opioid epidemic in our state.
That's wonderful. And as a follow-up for First Lady Kemp, those dollars are going to change lives. There'll be a huge impact across the state, and I know other states feel the same that are also receiving settlement dollars. But I don't think anybody is saying this will be the final thing that kind of ends the opioid crisis. The problem's still going to persist. And I wanted to ask you a little bit about, I thought the legislature signed in several laws this past session related to the overdose crisis, and what I thought was very interesting is they were very different. There was Austin's law, which created a new offense called felony aggravated involuntary manslaughter and creates a mandatory minimum sentence in Georgia for anyone selling fentanyl to somebody who later passes away. And then the other bills that were passed were very focused on naloxone, increasing access through schools, government buildings, vending machines for the first time. Can you tell us a little bit about kind of the early impacts of those laws? I think they both took effect July 1st.
Right.
And this kind of strategy behind taking very different approaches through the legislature.
Well, I think it's great. I'm all about harsher penalties and, holding people accountable. And I spoke with the families, and when Brian went down and signed the bills, and it's very impactful. But, I've spoken to a lot of kids at colleges and universities, and, I had a conversation with them one, and I was like, don't put all this pressure on yourself about what your grade point average is. And parents in here, I apologize if some of your kids were in there. But I said, when you get married, your future husband's not going to ask you what your grade point average was or however you graduated from school. Because if they do ask you that, you might need to turn around and rethink this whole situation. But, I just think our kids, they're putting a lot of pressure on themselves just in society and different things that go on. And that's when the conversations, in my opinion, are to just, say, hey, it's okay to not be okay. Are you okay? How's your day going? I mean, we have 3 daughters, and they have had, similar stresses on their lives as well. And I just want them to know that everything's not always going to be okay, but we can get through the situation if we talk about it and we have these conversations. But I strongly agree with holding people accountable and having harsher penalties to go after these perpetrators, like in human trafficking, that are selling these drugs to our kids, that knowingly are going to hurt them, and talk to them about the things that they don't need to be taken. But that is also a personal issue with parents. But I think a lot of people would agree on that.
I just want to follow up on a couple of things, too, on the opioid side. As healthcare workers, it's important for you to realize that the number one place people become addicted to opioids is in their medicine cabinet. So, and also on 988 is not just to connect people with mental health services, but it's also an addiction hotline. So if you have a patient who you feel like needs that service, let them know that 988 is there for that also. But keep in mind, too, the number one place people become addicted is in their medicine cabinet, in a prescription that they received. And so we're really focused on proper disposal. And part of some of the grants that you're going to see roll out is going to be to healthcare pharmacies and partnering with the Pharmacy Association and others to try to get the message out to people when they get that opioid prescription filled and they don't take it all. Don't leave it sitting in the medicine cabinet for your child, your grandchild, or the neighbor to take, become addicted, and then end up buying the fentanyl and other drugs on the street. So all of us collectively have a part to play in fighting the opioid epidemic, and you are really on the front lines of that.
I know we already gave everyone one piece of homework, which was memorize 988, which I think we've all done. But a second one on that topic as well. I'm going to poll the audience again like we did at the beginning. How many of you carry naloxone with you or have it in your car? Ooh, we need to do better, Health Connect South. All right, that's the second kind of homework item after 988 and trying to make sure meeting people where they're at. 988 is everywhere. Naloxone should be everywhere as well. So at the Carter Center, we've partnered back in the spring on the first Mental Health Parity Day at the Capitol with DBHDD, the Department of Community Health, and Department of Insurance. If you're not familiar, HB 1013 is our state's Mental Health Parity Act that Governor Kemp signed back in 2022. Something the Carter Center has been working at is how can we increase awareness so people are more aware of their parity rights and know how to file complaints with the relevant state agencies if their parity rights have been violated. The campaigns that we've done have been more targeted toward consumers, so I'm curious from y'all, now that we have a kind of a different audience today than's normally been the target of our awareness campaigns, what do you want the leaders in this room to know about the state parity law and what they can do to further support those efforts?
The state is getting, the Insurance Commissioner's Office and DCH, if it's Medicaid, is getting very few, if any, complaints. But then when I'm in meetings with some of our largest hospitals in the state, the message I'm hearing from them is they have hundreds of documented parity violations. So I was talking to someone you would know, I won't mention their name right now, but they're CEO of one of the largest healthcare providers in the state. And I asked the question, why are you not reporting those violations? And obviously, there's a fear sometimes of getting in the middle of that insurance fight. But it's important that if you have a patient that you feel like they're not able to access mental health services for them, their family, their children that they need, and it is a violation of both federal and state law not to receive that parity from your insurance provider or from the state through Medicaid and CMS, there is a process to report that to either DCH or the Insurance Commissioner's Office. And I would encourage you to help us, because what will eventually happen, we will start changing behavior in the host system, and all of us will recognize that this is just as important as physical health. So we've got to be able to make sure we're talking about that in a way that our officials can understand there are problems occurring and they can make sure that those get rectified.
Well, I encourage you to go speak to your legislators also about that, and I'm going to have lunch with my husband right after this, and I'm going to absolutely have the whole lunch hour, and we're going to talk about that because that's what the commissioner just let me know. So I'm going to do my job, so y'all go out there and put the pressure on your legislators too, because we need to talk about those things.
That's wonderful. Let us know what he says.
I'll be glad. I'll report back, I promise.
Great. So to close us out with a little bit of a lightning round, I've heard rumors it's election season. I don't know for sure.
46 days, I think. Who's counting?
Right. So we know for sure there's some vacancies in the state legislature. There's definitely going to be some rookies, some freshmen. Commissioner Tanner, you've been a freshman legislator before. First Lady Kemp, your husband, your father have been freshman legislators before. So if you were talking to a freshman legislator about to come in for January 2025, what would be the one thing about mental health you'd want them to know going in?
Well, I think number one, it's important for all of us, you, and just like the First Lady said, talk to your legislators, build a rapport with them, let them know this is really an important issue. And as an elected official, someone who's looked up to in their local community and the state, they have the ability to really affect change. And a lot of people thought, and I warned people about this, that when you pass a bill like House Bill 1013, okay, we can sit back, everything's been done. This is not a system that's going to be fixed with one piece of legislation. It's going to take all of us working for many, many years to fix this and improve the system. So I would just encourage you all, and I'm going to do the same, is to let our legislators and our new legislators know this is a very important issue to me and to you, and it's one that we're following and we want them to engage on.
And I would tell any rookie legislators or any legislators, you know, however long they've been there, to listen. You know, you can't learn anything if you keep talking and don't listen to what people have to tell you that's going on. And that's one of the things, like I said, we enjoy going around the state because you don't know, I mean, we all know what the problems are here, but you don't really know what the problems are in different communities and different rural areas until you go down there and listen to them. So that's what I would encourage rookie legislators and individuals is to listen, and y'all go talk to them and share what you have, because sometimes, shockingly enough, they may not realize that. They may not realize that individual problem that can be fixed with a piece of legislation that may not be, I know we're talking about a big issue here, but it may not, it may take some little bit of legislation that can tweak it and make a big difference in everybody's life. So I would encourage you to do that.
Absolutely. Well, I want to thank you both again for joining us here today. And when I was talking to Russ from Health Connect South earlier, we were talking earlier this week about President Carter's remarks from 10 years ago, and both agreed that they could have been recorded yesterday. They're still relevant to what we're trying to do today at Health Connect South. So we're going to go ahead and cue up a video of his remarks from 10 years ago and play them for you all now.
Hello, I'm Jimmy Carter. On behalf of the Carter Center, I welcome each of you to Health Connect South. Our state is blessed with many wonderful resources, the greatest being our people. Georgia is an unquestionable leader in advancing global health, thanks in no small part to those of you gathered here today. The Carter Center spends a majority of our time and resources advancing access to health services for some of the poorest and most neglected people in the world. We teach communities how to prevent devastating diseases such as guinea worm, river blindness, and trachoma that can cripple entire economies. By working with local groups as partners, we build both their capacity to sustain these disease prevention efforts and their potential to address new health challenges in the future. We also have seen how much greater the impact can be at the grassroots when partnerships are formed among international agencies, governments, non-governmental organizations, corporations, and national ministries of health. Our future ability to improve global health relies on engaging in collaborative conversations and agendas to make progress on the most pressing health needs. Today represents a call to our community, not only to learn more about the latest health research and solutions, but also to better understand health challenges that need to be addressed. Working collectively, we can open the door to untapped opportunities to advance health and to accelerate progress. Congratulations on taking the first steps toward committing to a better tomorrow. The Carter Center stands with you on this journey, and working together, I believe we can accomplish great things in Georgia and beyond.
Just as relevant as it was when it was recorded back in 2014. I want to thank you all again for dedicating part of today to mental health, and please help me thank again First Lady Marty Kemp and Commissioner Kevin Tanner.
Thank you.